We are here with Representative Tina Orwall with the 33rd District. How are you doing today?
Good, thank you.
Second week of session. You've been extremely busy. I would like to ask you about three of your bills. Let's start with rape kits.
Yes, well, as you recall, last year we had a bill that required the testing of kits moving forward. And so we wanted to come back this year and really address the 6,000 unsubmitted, untested kits. And we want to do this in a timely way, and it's important that the victims have justice and that we're really getting some very dangerous perpetrators out of our communities. And so we'll be looking at these pilots, which will bring together an investigation team. It'll have a detective, a victim's advocate, and the prosecutors, and they'll start testing about a fourth of the kits. And other areas that have done this have found that about 30% are serial rapists, and so we'll have to see what kind of findings. But we want to move, and we want to move quickly. We're looking at a variety of funding sources in this bill. We obviously are going to continue to look at state funding, but we do introduce a fee that is put on sexually oriented businesses, strip clubs particularly, and that would help us fund some of this activity.
Now, one of the things that this bill does is actually track every rape kit, correct?
Yes, it's really putting technology to use. I mean, if you really think about the victims that didn't have their kits tested, they probably assumed they were tested. And this new technology is actually going to allow us to put a scan code on each of the kits, and we'll know where they are at every step of the process. Also, a victim can go online and check the status of their kit and know where it is in the process.
The second bill I want to ask you about is related to suicide prevention. You've been a champion for suicide prevention. You've written many laws. This one is a little bit different from the ones that you've done in the past. Tell us about it.
Well, you know, I'm really proud of the work we've done. We've really moved forward on training and other things, and really are the first in the country to take on some of these pieces. This is a different bill. This is in partnership with the University of Washington, but we brought new partners to the table, including the NRA and the Second Amendment, and pharmacies, because we wanted to have an approach around raising awareness of suicide and lethal means, and we needed new partners to do that. Not only do we want to get that message across to gun stores and pharmacies that these different methods can be very lethal, but we wanted to do it in a way that would really connect with the people that use those services. And so we're bringing together this team. We're also going to pilot in 2 areas of the state that have the highest suicide rates. And we're going to go in and we're going to do engagement with the gun store owners, and we're going to go into pharmacies so that they can learn about this issue and be part of the process of disseminating information and part of the solution, which is raising awareness.
And the third bill I want to ask you about is a controversial but very important bill, and you did this last year as well. It's raising smoking age to 21.
Tobacco has had a big impact on my family. I lost both my parents related to their smoking. My mom died 2 years ago of lung cancer, and they both started as teenagers. And I saw them as I grew up struggling, trying to quit numerous times, and really struggling with the addiction. And as a mother of 2 young adults, I don't want my kids to start using tobacco, nor any kids in our state. And I think what happens is I think the tobacco industry realized that's a very vulnerable age to actually market products, and they've known that for a long time. But we know there's information going all the way back to 1986 where they identified young adults as being a key part of their market and really wanting that to that product to be available. And you know, even looking at the new vapor products, you know, some of them come in bubblegum flavor, vanilla cupcake. You know, they really, again, are targeting our youth. They're very susceptible. And if you really look at nicotine compared to alcohol and marijuana, in many ways it's much more addictive. And we know that using it will go on to a life of addiction and very serious health conditions. So I think we have a window here that can make an enormous difference by changing it to age 21. And I really hope we can move forward this session on that policy.
How does this bill keep youth from smoking?
Well, you know, the research really has shown that 9 out of 10 adult smokers started before the age of 21, that is a key window. And also, when we look at who buys products for 13, 14, 15-year-olds, it's teenagers. It's their peers, usually around 18 years old. And so again, by moving that age, we're not only going to get these products out of the schools, but we're really going to make it difficult for the teenagers of all ages to really access them.
Well, thank you very much.
Thank you.
Good luck with your bills, and we'll see you next time.
Thank you.